What if your body was quietly trying to warn you about a deadly disease, but the signals were so subtle you missed them? Pancreatic cancer is often called the silent killer because it hides its symptoms until it's advanced. But today, we're going to break that silence. In this video, we're uncovering 6 warning signs of pancreatic cancer that you should never ignore. Some of these might surprise you, and knowing them could make all the difference. Now, it's important to remember, having one of these symptoms doesn't mean you have cancer. Many of these signs can be caused by other, much less serious issues. However, if you notice several of these symptoms or any one that persists and gets worse, it's time to talk to a doctor. Your health is too important to ignore these signals. So let's get into it and stay informed and safe. 1. Yellow skin or eyes, jaundice. Ever look in the mirror and notice your skin or the whites of your eyes turning a yellowish tint? This yellowing, known as jaundice, is one of the clearest warning signs of pancreatic cancer. It happens when a substance called bilirubin builds up in your body. Pancreatic tumors, especially those in the head of the pancreas, can press on the bile duct that normally gets rid of bilirubin. The result is a yellow pigment spreading in your skin and eyes like a highlighter pen marking paper. Jaundice often comes with other changes. Dark urine. Your urine might turn deep amber or brown, even if you're well hydrated. It may look like tea or cola. Pale, greasy stools. Your poop might become light-colored or float due to excess fat. Itchy skin. Biochemicals in the skin can make you itch all over, like an itch you just can't satisfy. Jaundice can be caused by other things too, like gallstones or hepatitis, so it doesn't automatically mean cancer. But no matter the cause, jaundice is a red flag that something's wrong. If you or someone you know turns yellow suddenly, don't brush it off. See a doctor promptly. 2. Unexplained weight loss. Imagine stepping on the scale and seeing the numbers drop week after week, even though you're not dieting or exercising more. Unexplained weight loss is another red flag that can come with pancreatic cancer. Your clothes might start fitting loosely for no clear reason. Cancer can make your body burn more calories and prevent you from absorbing nutrients properly. In simple terms, you could be eating normally, but your body is starving for nutrients. Over time, that leads to weight loss that can be pretty dramatic. Of course, weight can drop for lots of less serious reasons too. Stress or other illnesses might cause a few pounds to fall off. But if you lose more than about 5–10% of your body weight without trying, it's time to see a doctor. It might not be pancreatic cancer, it could be something like a thyroid issue or another condition, but it's important to find out what's happening. 3. Loss of appetite or feeling full quickly. This symptom often goes hand in hand with weight loss. You may find you just don't feel hungry much anymore, or you get full after only a few bites. Loss of appetite, or feeling full really quickly, early satiety, is common in pancreatic cancer. For example, maybe you normally love a big dinner, but now after just a few forkfuls, you feel done. You might even feel bloated or a bit nauseous if you try to keep eating. Why does this happen? A growing tumor can press on the stomach, making you feel full faster. Also, when digestion is disrupted, food might sit in your stomach longer, so you don't want to add more to it. Again, lots of things can kill your appetite. A stomach bug, stress, or certain medications can do it. But if your hunger has vanished for weeks and you can't figure out why, it's worth getting checked out. 4. Persistent abdominal or back pain. We all get aches and pains, but pay attention to pain in your upper abdomen or middle of your back that doesn't go away. Pancreatic cancer often causes a dull ache in the upper belly that can radiate to your back. Many people say it feels like the pain is wrapping around from their abdomen to their back. This pain might come and go at first, and it often gets worse when you eat or when you lie down flat. It happens because the pancreas is tucked deep in your abdomen, near nerves and the spine. A tumor there can press on nerves, causing that radiating pain. Remember, most tummy or back pain is not cancer. It could be something far less serious like heartburn, pancreatitis, or a pulled muscle. But if you have an ache in your upper abdomen that won't quit, or a back pain that isn't from a known injury, especially if it gets worse after meals, get it checked out. This is even more important if you also have any other symptoms on this list. 5. Nausea and digestive problems. Pancreatic cancer can throw your digestive system off balance. The pancreas makes enzymes that help you digest food, so a tumor can interfere with that, leading to nausea, vomiting, or other stomach issues. You might feel queasy often, particularly after eating, or even vomit for no obvious reason. Some people notice constant indigestion or heartburn that doesn't improve with the usual remedies. Because your food isn't being digested properly, you might also have changes in your bowel movements, for instance, frequent diarrhea or stools that are paler and float. Again, everyone gets an upset stomach or nausea sometimes. Maybe you ate something bad or you have acid reflux. But if these digestive problems are persistent and unusual for you, it's time to have a doctor look into it. 6. New onset diabetes or blood sugar issues. This one is a bit unexpected. A sudden diagnosis of diabetes could be a sign of pancreatic cancer. If you've never had blood sugar issues and suddenly your doctor says you're diabetic, or if your well-controlled diabetes becomes hard to manage, it might be linked to your pancreas. The reason is that the pancreas helps control blood sugar by making insulin. A tumor can disrupt insulin production, leading to high blood sugar. Some research has found that an unexplained new case of diabetes in an older adult can be an early warning sign of pancreatic cancer. Now, most new diabetes cases are not cancer, far from it. But doctors pay attention when a healthy weight person over age 50 develops diabetes out of the blue, especially if they also have other symptoms like weight loss or abdominal pain. It's something to be aware of. Stay vigilant and take action. Hearing about these symptoms might be scary, but remember, having one or two of them usually doesn't mean you have pancreatic cancer. These signs can be caused by many other things. The key is not to panic, but also not to ignore your body if it's giving you hints. If you have a few of these symptoms together, or one that sticks around and gets worse, see a healthcare provider. Early detection is tough with pancreatic cancer, but being alert to these warning signs gives you a better chance. Now, a question for you. Did any of these symptoms surprise you? Were you already aware of them? Let me know in the comments. By sharing your thoughts or experiences, you might help someone else who's watching. If you found this information helpful, please give this video a thumbs up and subscribe for more health tips. It really helps our channel grow. Don't forget to hit the notification bell so you don't miss any new videos. Thank you for watching, take care of yourself, and see you next time.